Hi, my name is Melanie Young, and I'm a certified nurse's assistant, and I am getting my associate's degree as a medical assistant. Right now, I am a caregiver to both of my parents, where I am living in their home for about a month now. There are four things that I would like to discuss with you and that I think that are important to being a caregiver. The first one is medical training. The second one is safety. The third one is administering medication. And the fourth one would be living arrangements. I actually read an article in the April 2000 issue of the American Family Physician that said that 90% of injury-related accidents to the emergency room are from falls. 1/3 of them occur in the home, and 60% of them occur in the nursing home. And in the emergency room, if they go into the emergency room for a fall, if you're over the age of 65, usually it occurs in death. So I thought it was very important that you know the correct safety on how to carry one of your family members and move them in and out of the shower, the bed, the chair, the car, things like that. We also, most patients, most senior citizens have a wheelchair. And that is very important safety issue that you need to learn. When you go to the Red Cross, which is part of your medical training, which I'll explain to you, you will learn about this. But I'm going to show you just a couple of steps right now, since I have a wheelchair in my home. And that would be making sure that the pedals, when you want to take them out, that you lift both the pedals up and have their feet on the ground. That you have both their feet on the ground. And also that the brake is in place, so they can't move. Okay, anytime that you leave them, you want to make sure that the brake is in place. Okay, so you will learn that at the Red Cross. One of the best places to go for medical training, since we already discussed safety, one of the best places to go for medical training without a lot of money is the Red Cross. All you do is go to www.redcross.org, and you type in your zip code, and it gives you the directions, the nearest location to your home. They teach first aid, CPR, and AED, which is breathing apparatus, oxygen masks, sleep apnea, things like that. And so that's very important to know. Another thing is going to your local bookstore. They have everything from putting on a Band-Aid, to which, I'm sure that I could use a few, and to CPR, to spraining an ankle, anything. You can learn. You can get a book on just about anything at the bookstore. The other important thing to do is go on a chat room. Get on a computer. It is necessary to have a computer. Get on a chat room, and so you can talk to people that are in the same situation as you, or go to a local facility and join a group. Okay, so that you can all talk about your experiences and get some information from other people that do the same thing as you. Now that we've talked about safety and medical training, I would like to talk to you about medicine, administering medicine. It's necessary that you know what medications that they take and what they're for, And I mean, obviously, how much to give, and definitely the side effects that they have. Make sure that you ask the physician if there's any medications that you should not give together, okay? Or if it says take with food, make sure that you give them a little snack or give it to them at mealtime. Whether it's short-term care or long-term care, all of these things are extremely necessary. They're necessary, okay? You don't want to hurt yourself, and you don't want to hurt the person that you care about the most, okay? Um, uh, I'd also like to speak to you about living arrangement. That's the fourth main issue, and which is actually the hardest issue to talk about. You could live in a one-bedroom apartment or have a house with a family, and it could be short-term or long-term. So if it's a short-term situation, you would probably want to stay with the person who's had maybe surgery or a broken leg, just needs help for a short period of time. And if it's a long-term situation, your home would probably be the best for that. Make sure that you talk to your children if you have any, or any other family that's living with you. Let them know what's going on, because it's great to be surrounded by your family. Now that we've talked about training and safety and medical medicine administration and living arrangements, it is time to become a family. And remember that everybody has pretty much just lost their independence and trying to figure out a way to get some of it back in their own way. Be kind and be patient, laugh together, but most of all, love each other. Have a good day. Thanks for listening.